Hello, everyone. My name is Bharat Patel. I'm the chairman of AAHOA. I'm happy to represent over 20,000 members with over 35,000 hotels. Recently, I was in Ohio, at Cincinnati, at the regional. And at the regional meeting, we had a guest speaker, Dr. Kamal, and he just started talking about health. And the reason it really impacted me is because, I had a heart attack in 2019 before COVID. December 14th, in and around 9:30, 10 o'clock in the morning. And I'll get to more details, but the crazy thing is, Dr. Kamal speaking my language. How can I be a health advocate and then also lead the association, right? And I don't think those are two things are not, they can be combined. It's not incongruent. So that's why I'm here. Thanks for inviting me, and I want to make sure we get this out to our regular AAHOA channels. So Doc, how do I start my journey? I thought I was sort of invincible, right? When it came to health things, I do my physical exam. We started a running club, and let me tell you a little bit about my health history and my parents. On my mother's side, grandmother, she died of a heart attack, right, in her 50s, right. My grandfather lived to be in his 90s. All right, so clearly he lived 40 years almost on his own, and it could have been different, and that's sort of the warning. And so for me, when my father got taken in to take some stents, it was a warning sign for me. So then went and go see the cardiologist, and the cardiologist goes, I'm sitting there worried and all that. He's like, Mr. Patel, you have to, be active 3 times a day, 4 times a day, and also that kind of stuff. So, I'm there talking to my son, and he's in elementary school, and we're like, okay, so what can we do, right? So what can we do? And we thought about this. Let's start a running club, like a jogging club or running club, and maybe there'll just be a few students. And so, long story short, we got the club started. It took almost a year, but we ended up with a school of less than 500 kids. Over 120 people were members, right? But what was great for me, what I figured out was my mom and dad were both walking and sometimes fast jogging and doing over 100 miles a year. So we would track every mile they did, right? And so I was at 150, 160. We had one child at 200 miles, right? We did a bunch of charity 5Ks. So here I am focused on health. And so one of the last 5Ks I'm running, it's on Siesta Key Beach, which I want to invite everybody to come and see. It's in Sarasota, one of the top beaches, top 5 in the country. And, it's this nice crystal sand, blue waters in December. It's nice and cool outside. We're running. And I look at my watch, actually the same watch I wore right now, and it's a little bit high, spiked, and then I collapse. Then when I collapse, I didn't see anything next until somebody showed me my iPhone and were trying to get my ICE contact information. And what had happened is the EMTs had trying to get my information out. They're waking me up and saying, Mr. Patel, do you know where you're at? Also the kind of stuff. And this harkens back to so many other stories I've heard with members of AAHOA, right? One in like New York area, upstate New York, I think it was. And what happened is, the person said, this really hit me. If I can talk about this, Dr. K, is I was sitting there, the person was sitting there lying there, and he had chakare, right? He was a little bit dizzy. And so he told his wife, you know what? You take the kids. When you come back, we'll go see the doctor. When she come back, he'd already passed by that time. We're talking about maybe 20, 30 minutes, right?
Yeah.
And he's in his, I think, late 40s at the time, right? And you and I were on stage, and we're talking about literally every month, we hear about somebody between the ages of 35 and 55, heart disease or diabetes or something, just taking them. And the crazy thing is, if I can say this, is they don't know it, right? I didn't know I suffered from heart disease. I kind of had the history of it. I think all of us do. So I'd like to talk to you a little bit about it, carry forward is, what is it about heart disease? What is it about, diabetes, especially for Indian Americans, Gujaratis here in America? What's happened in the last couple of decades is completely different than others, because diabetes used to be something rare. I didn't hear about it.
Right.
So from your medical point of view, what do you think? And I want to chime in.
Sure, no problem. So I'll give you my background. I'm a vascular specialist, and I grew up in the hotel business, just like everybody else. Actually, attended the first AAHOA meeting in like 1988 with my uncle. Chose to go to medical school, but as a vascular specialist, I'm very in tune to like vascular disease. So my area of specialty is limb salvage. So I work with diabetic patients trying to do limb salvage, amputation prevention kind of work. But over the years in my own family, so my father had his first heart attack, a quadruple bypass at age 49, my kaka at 52. I have one mama who died of a stroke at 67, 68. My other mama just recently passed away at like 72. And so this is something that was like really kind of hitting me personally, and just a part of the community in the local Cincinnati area. I pretty close to all the volleyball guys and the AAHOA folks. I still kind of participate, so I'm getting calls for all kinds of different things. So I'm starting to realize this now in going to my own doctors. So my doctor, I have a cardiologist because I wasn't taking any, I was being really, really cautious, really, really early on. But what I started to realize is that for Indians, and there's a historical, rational reason why we have this higher risk than almost any other like ethnic group. But the point is, even here in the U.S., we're not getting the thorough pre-symptomatic evaluation. By the time somebody becomes symptomatic and they're getting chest pain, it's too late, right? Because the first time you get chest pain, you were lucky. You were here. You could have been in a foreign country, and or it could have been much, much worse. And so the time of getting your first chest pain episode is too late, basically, for an Indian patient. And the reason behind all of this, really, Bharat, is that our metabolism. We have what's called metabolic syndrome, and this is a condition that affects patients well before diabetes. So what we'll hear in our community with Indians is that we're getting heart attacks before the diagnosis of diabetes, right? So I get so many patients who are like, "Yo, I'm fine. I don't even have diabetes."
Right.
And some of this has to do with the way we're testing for it in the U.S. We're doing a fasting blood sugar level. And it takes 12 hours, and the sugar level is normal. And then we measure that A1C level, and the A1C level oftentimes is maybe marginally elevated. But what happens is that there's a couple of components that causes the blockage in the blood vessel. It takes basically two factors. One is a lipid abnormality. So everybody knows about cholesterol. Everybody knows about LDL, HDL, triglycerides. But what we don't know is that there's subcategory of lipoproteins that are very high predictors. That are only elevated in certain ethnic groups that we just routinely don't test for. On the other side, if you have some of these bad actors, this bad cholesterol that we're not testing for, then you're going to be at unusually high risk for early heart disease. This is folks who are getting heart disease in their 30s and 40s. So my brother-in-law, my wife's brother, 42, he started having chest pain, and I was luckily around. So I'm like, hey, something's not right. Next thing I know, he's got 2 stents at 42. He's completely vegetarian, does very mild drinker, exercises. So the other component that nobody really kind of focuses on, at least in healthcare, is the blood vessel wall in the heart has to become inflamed, or what's what we call endothelial abnormality or dysfunction. So it's a combination of the blood vessel wall becoming damaged due to inflammation and then having abnormal cholesterol. The real bad actor is triglyceride, even more than anything else. And so people don't realize that high levels of triglyceride are not a function of fatty foods. It's a
Right.
function of carbohydrate metabolism. And so the gist of this is that in our Indian, our hereditary pattern, the frequency with which we're eating, especially the certain types of carbohydrates, is what's causing this early inflammation. And boom, if you have some of these bad acting cholesterol, then you have this perfect storm. Now, historically, the reason why Indians are so highly predisposed, it has to do with the history of India and the British occupation of India. So during the 200 years that the British were in India, we had massive starvation and famine. Over 30 million people died. And for about 7, 8 generations, we are constantly starving. So 7, 8 generation, you and I are products. If you ask your great grandparents and you start doing your history, about 50% of babies died because of massive starvation. So what happens is that we've acclimated, our bodies have acclimated to a fasting kind of state where we just can't handle, even at smaller quantities, the type of food, especially the processed food, white flour, and the frequency with which we're eating. I think these are culprits. And then on top of that, 25% of the patients have this abnormal gene lipoprotein, which is this abnormal LDL called lipoprotein little a, which I'm suspecting, I was looking at your labs and I want you to
Yeah,
get
feel free to
tested.
share. Like, what kind of tests should we ask for? And let's talk a little bit about LPS Health. And I saw the YouTube videos you sent me on LPS Health about, there's like you want to take a snapshot of your heart, right?
Yeah, so
So,
this program is called One Tuka 4. So my goal in India is not to put this under like any kind of one community or the other, right? So if you go to One Tuka 4 Health, there's a 3-phase cardiology type of workup, pre-diabetic workup, and it's a combination of 8 imaging studies and this very advanced like lab work that's going to tell me what different inflammatory biomarkers and this advanced lipid profile. Now, the problem is here, let's say that I think I sent you the list, right? So if you're pretty lucky and you have a doctor who says, okay, you know what, I will order this for you, Bharat, then you're lucky. And, insurance will cover it, but, even if it doesn't, it's still worth doing. But most of my patients, when I send in this list, including my own brother-in-law, who has an Indian cardiologist, the guy won't order those studies. He goes, oh, it's not standard of care. It's not going to be covered by insurance. It's overkill, blah, 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 blah. And so that's one of the things that I know in India, I can get this stuff done. There's no barriers. On the radiology studies, we're doing so. Number one is we want to know what the piping looks like, right? The calcium score. A lot of people ask me, "Hey, doc, I get calcium score, but the way a clot happens, it starts with a soft clot, and then over time the clot becomes hard, and it becomes calcified. So when you can see calcification in the heart, it's kind of a late sign that you've had coronary artery disease for years. So by the time your calcium score becomes high, you've already had vascular disease. There's inflammation and you're already starting to get some amount of narrowing. So CT coronary angiogram, that's the first test in India. But it's just a piping, right? Just because you got a blockage, it doesn't mean that it's giving us any functional information. So the next step, which is like really groundbreaking, is we have access to a functional MRI or a cardiac perfusion MRI. Now, this is a very special MRI with a software packet that tells me exactly how much blood flow is getting into the muscle. It's analogous to doing like an echo, but it tells me at the cellular level, oh, okay, let's say that you have 50% blockage, but you're getting great blood flow to all your muscle, in which case you're lower risk. Let's say that you have 20% blockage, but that muscle that it's feeding is now not getting enough blood perfusion. This MRI tells us this. Why is this important? You can't get this anywhere. I'm in Ohio. The only place in Ohio that we can have a cardiac perfusion MRI is at the Cleveland Clinic. Ohio State doesn't have it. The University of Cincinnati Medical Center doesn't have it. Only a few of the centers in the country actually have this. And then even if you want to get it, more than likely they won't offer it to you. And then it's ridiculously priced. The scans are tens of thousands of dollars. And then even then, who's going to put it in the context of you being Indian, matching all the labs, and saying, hey, I know about your genetic predisposition. The other things is a fatty liver. So one of the early signs of metabolic syndrome is that you don't get fat on the outside. Your liver starts to get fat. And so we do an ultrasound. stroke, carotid ultrasound, what we're not only looking for is the risk of a stroke, but the blood wall thickness. It's telling me indirectly what the heart wall is looking like as well. Fibroscan, how hard is your liver? So it's about, and then echocardiogram, EKG. So it's a very comprehensive way of looking at so many parameters. And after this, I can pretty much give somebody a really, really strong predictor and indication that, hey, if you don't seriously start doing something in the way of preventative care, this is disaster. It's coming, you know. And my estimate is for an Indian guy at 40, about 20% I'm going to find. And that's what I've been finding so
So
far.
how young should somebody get the scan done? And it's available in Nosari?
Yeah, so my program's in Nosari and Bodily both, but the hospital that I'm just lucky. We're very lucky that all this equipment happens. You know, it's interesting what's happening in India. They because it's such a super competitive market space, they buy like the craziest advanced imaging, and even though they may not have patients that even they don't have the program, but you know they have all this equipment there. And I'm just lucky that I got in contact with them. So my program, the 12.4 program, is not affiliated under any hospital. It's an organic program, so that the entire thing is structured under my umbrella, and so that there's no bias from any Indian physicians there, right?
Right.
At the end of the day, so right now it's something that's
We're
based out
just
of
getting
India.
information. It's not like you're
But
making a healthcare decision. We're just getting the information so we can get the data set right, right? So whether you're
exactly,
5, 40, or 45, or like me, already had a heart attack, let's look at it. Let's not just look at ejection fraction rate or some of these other things. Let's look at the entirety of the heart and what's supplying the heart. And
yeah,
then in consultation with you or any other cardiologist, come up with a
yeah.
program it's going to do, right?
So once you're in the system, like, you know, it's awful what happened to you, but in many ways it's a blessing in disguise because once you are diagnosed and you know heart disease, very few people die. Like my father, my kaka, they're like, oh, my kaka's in the 80s, my dad's late 70s, it's very manageable. But the key is early detection, right? That's what we're looking at. So I'm hoping, and I have some ideas on how I can introduce this blood work here in the U.S. Because so many people are like, well, hey, you know, I'm not going to go to India anytime soon. Like, what is there anything we could do here? And I have some ideas on what we can do here as well on at least getting this advanced blood work started, right? Because that's the first step. Is if I know the blood work's abnormal at a young age, then I'm like, okay, there's you know, where there's smoke, there's going to be fire. So
So, I was at a wedding this past weekend, and I've talked to people since Ohio, since we met a couple of weeks ago. And, people have come to say, but why should I? It's this whole logical reasoning and kind of thing is what I'm getting at is some people are like, well, why should I do this? Because once I do this, doctors always find something. There's one thing.
yeah,
Second thing, when they find something, then they're going to want you to adjust your diet. Well, but I live to eat. I don't eat to live,
yeah,
right? So why should I start taking the medication now? On the flip side of it, we'll cover this in a second. You know, why wouldn't you, right?
yeah,
Like,
yeah,
don't you want to live longer? And
yeah.
so maybe you can touch on that, and we'll talk a little bit about a couple
Yeah,
other
so you
items.
know, it's funny because like if you look at the constituency across the board of like the Gujaratis at AAHOA, like you know, it's a very special breed of people. You know, they're folks who, by and large, their view on life and death is very different than a lot of other communities, right? And we're of the type that you know is kind of carefree. And I, by all means, if you ask any of the guys in Cincinnati, I do not you know, I don't try to preach to anybody because you know it's a very very sensitive topic. You know,
Yes.
so here's how I address it. Right, like so there's a couple of like dynamics that the way I think about and why I'm kind of like wanting to kind of introduce this. To me, you know, I don't have any daughters, and so the most tragic thing in life would be to not be able to go to your daughter's wedding. That to me would be like, oh my God, that you know,
Yeah.
and I've seen this. I've been to weddings where, the bride's dad is not there to walk her down the aisle. So that just kind of gets to me, And I know that, this is something we can prevent. Now, how do I get these guys to start to understand this? So I do tell them stuff like this. I go, hey, this, and the examples are there. I can usually cite two or three guys in the community that somebody knows. Hey, look at, remember that guy, and there's a lot of sorrow, and but everybody thinks it's not going to happen to them, right?
Right.
So then the other thing is the modification in lifestyle. I think once I can tell somebody that, let's say that, you knew that you even had a 20% blockage in one artery, you now know it's in your realm of reasoning that, look, hey, um, something's going on, right? They can make the plumbing analogy that, like, at some point, and I think that's kind of real. This type of testing, it's very visual. I could kind of show them, hey, look, here's the blockage. It's multiple blockages. And I think that psychologically that leads to behavioral modification. So
Right. And you can decide whether you're going to have a large change in your diet or a small change,
yeah,
right?
diet. And now, the other thing is we
Hmm.
have a lot of other treatment options, right? So one of the reasons I got into this is I offered a procedure here in the US where it reduces appetite. It's a vascular procedure. And so the hormone that's responsible for appetite, we have a procedure, it's an outpatient procedure. We can lower the hormone in your blood and it reduces appetite. And I started doing this procedure and I realized that a lot of people would stop eating, right? Because there's a lot of psychological components to this.
Right.
Then there's like food addiction, right? There's a lot of psychological components to this. For us, especially Gujaratis, in general, for humans, food is love. It's a
Yep.
way that we socialize, and I think we're probably on the extreme, top end of that, right? And so, but in the context of all that, there are ways. Now there's pharmacotherapy. There's these types of procedures we can offer, and it's just a matter of education. And I lost 40 pounds once I started understanding I have metabolic syndrome. I started working on intermittent fasting or time restricted dieting and just explaining certain foods, not all food. It is not about you can't eat any carbs, right? It's like very specific carbs. You can cut out a few of these things and you could do even time restricted dieting and you can get into a window of even 12 hours. It could be dramatic in how it can change your metabolism. The other interesting thing, and this everything I have, it's on my website. It's all research proven, uh, published papers. Now you can reverse heart disease if you can reduce the inflammation.
That's
Once
sort of
it's
the
calcium,
Cornish diet or the Atkins diet. They talked about that. Can you reverse heart disease?
yeah.
And
So
there were four people standing up there for that peer-reviewed study. So if
yeah.
you want to cover a little bit about that, I think that would be great.
So it's the analogy is there's a point at which, like, if the plaque is calcified and hard, you cannot, you got to go through it, or with a wire and an angioplasty and a stent. But if it's soft, if it's just inflammation, then you can reverse the If you can reverse the inflammation, you can see that the body has a very amazing way of healing itself,
Yep.
and that's a function of how we can control inflammation. So the number one thing that we are not recognizing in healthcare, the average your primary care doctor, cardiologist, is what happens with insulin levels. So, sugar is bad. We know that. But if you have high levels of sugar, people can have high levels of sugar. You see, like, people in the community, some guys don't even take their insulin. They're eating like crazy. And, nothing kind of happens to them all of a sudden, because sugar is not, it's a slow killer. And, when it starts to affect patients, it affects your eyes, it affects your legs. But what's really causing the problem is every time you eat something, your insulin levels in your body spike. And insulin is it's a killer. It's a pro-inflammatory hormone that's causing not only vascular damage, but even like dementia, Alzheimer's. Now, the technical term for Alzheimer's is diabetes 3. And now we know that that's mediated with high levels of insulin.
Right.
So, let's say that you measure your glucose in the morning and it's normal. So you're like, okay, I'm good. And your hemoglobin 1HC is like 6. But in the morning, if you measure your insulin level and it's still very, very high, that means that, that your damage is like not, you're not getting any rest. The other thing is you can't mobilize fat. So the insulin's job is to take your food and your calories and shove them into fat storage. So without reducing your insulin, you can never mobilize your fat. This is why diet and exercise doesn't necessarily work, because it's a survival mechanism. It's an absolute survival mechanism. And this is why we have insulin resistance. So you noticed how Indians, we have such a hard time building muscle, because over all these years, we've acclimated to the sugar, which is the source of energy, gets shunted to the vital organs, the brain, the heart, and this is why we can't drive sugar you need sugar to get driven into the muscle to make the muscle bigger. So it's very, very hard for, Indians to build bulk of muscle, because over a couple of hundred years, our receptors have just acclimated to like not letting that sugar in. So that's what's got spikes the insulin levels, if that makes
So,
sense.
we talked a little bit about lifestyle and some other things, motivations, right? And so, there was it was a TV interview, but I'll cut to the chase. Is billionaires being interviewed, right? And they don't get out of bed to make more money, or the next billion, or the next 50 million, whatever. And so I don't get out of bed because I want to build a new hotel, right? I get out of
Yeah,
bed because I want to leave a legacy for the next generation, right?
yeah,
Last night when I was talking to people, whether it's about paying for a wedding or doing these other things, it's not about the extravagance. It's about the ability to kind of make your family happy and provide the things that the last generation wasn't able to do. So
yeah,
while we had a large wedding and and everything else like that,
yeah,
it really is not on the scale that I see nowadays, right? Whether it's the Ritz Carlton or the Hyatt or whatever else,
yeah,
you've got we spend a huge amount of money, and the way I explain it to my hotel colleagues is, there are hotels in Florida and other places they wouldn't allow Indian food. When they realize this type and scale of weddings and how big they were, they're like,
yeah, yeah,
we need to find caterers that will do this food, right?
yeah,
And so, when you talked a little bit earlier about legacy, about daughter walking down the aisle, but I think it comes down to, we have sweet 16s, we have, graduating college, graduating high school.
yeah.
There can be a reason code for almost any event that we get together, right?
No,
So,
absolutely.
right. And so
Yeah,
you want
no.
to be this, and you're talking about small changes, right? To be around it. And knowledge is the first one.
So, there's an arc in every civilization, in every community. There's an arc of like having like the needs and then the wants. And so we were a community of like basically most of us are farmers just 2 generations ago, and then we were laborers and we got into this great business. And now the next generation, you're absolutely right. Like most of these folks I see it's bending, right? That they're having more meaningful like experiences in their life. Like folks are traveling all over the world. There's so many people who want to go see the rest of the world. I was just in Egypt a couple of weeks ago, and we went climbing in the pyramid, and I'm like, oh, it's a good thing we did it now, because I don't know in a couple more years, if this is going to be something. So, and then wanting to stick around to see the grandchildren and what they're going to do. Like, I start to see this when I'm talking to our folks. They're starting to like put all these pieces to the puzzle together, right? And so I think we're getting there as a community. So.
So, a couple other things, people are worried about, say, for example, I think we talked about this briefly in Ohio too, was life insurance tables are changing. So if a life insurance company is looking at our particular American Indian community on a different scale, doesn't
Yeah.
that say something about this crisis? Anything you
Yeah,
want to touch?
yeah. So actually, after I started my program in Nosati, this month in November, John Hopkins just published a research paper in JAMA, which is our premier healthcare journal. They published a paper, and then so they come up.
This is the Journal of American Medicine, right?
Yeah, exactly.
Association, sorry.
And so the American Heart Association has come up with a new syndrome, and they call it cardiovascular, kidney, and metabolic disease. And they're starting to stage this now. The important thing is that they're starting to advocate that we start screening patients before they're symptomatic. That's the key. And they're describing everything that I'm talking about. But what will happen, Bharat, is like the U.S. healthcare system, from some kind of recommendation like that to somebody in a smaller, the average doctor actually implementing it takes years and years and years. And even then, this thing doesn't mention anything about Southeast Asians, right? Because the Hispanic population in this country and the African American population in this country are also kind of dealing with similar issues. It's not as early as Indians, and then we don't come off. We're affluent folks, so we don't fit the profile.
Right.
Another big misconception is that you have to be obese to have disease, right? And so metabolic syndrome can affect like somebody really, really thin and somebody's, I mean, you're a classic example. So it's a very stealth type of thing. It's very hard for me to predict just based on lifestyle. If there's some guy who's living, he may be way metabolically healthy, being overweight by 50 pounds than somebody who's underweight.
Yeah, I think we all talked about that earlier, where body mass index, where we're all concerned. First, it was the weight, and
yeah,
then it was body mass index, right?
yeah,
And so what I tell people, even in the hotel business, first we worried about occupancy rate, then we started worrying about average daily rate, ADR, and now
yeah,
it's RevPAR, which is a combination of the two.
yeah,
But in health analysis, it's one of those things where there's multiple factors. What do you combine, and sort of, what do you do next? Because I think some of them, and maybe you want to address this part, is some of them say, well, when I go to the doctor's office, they're always going to find something, right? They're always going to do this or that or
yeah,
that.
yeah.
I remember one doctor telling my dad, and he goes, Mara ho paisa to banao por na. So what he's
Yeah.
saying is that if you don't
I
come and
know,
see me,
I know, I know.
right? So how do you want to address that?
Yeah, I think what we have to do is the best that we can. We got to start somewhere. And there's some people that are just not going to see it. And that's okay. I don't just, try not to discriminate. There's guys in Cincinnati, folks that I'm sure you know really well, that I had to really kind of twist their arm, but I only
Yep.
in opportune times. So what happens through the course is somebody will have some kind of illness thing. And my philosophy is just be around and be available, answer a few questions, right? And that's when you can start interjecting. And then as they start to hear and see more funerals going on, then they're going to do the trade-off. They'll start to see the trade-off. But it's slow for our community. There's no question it's slow. But I think we just need to have some kind of inertia with the community, so that we're talking about this. And then what I'm doing, I think I'm trying to take advantage of the social media component. I'm not a real social media expert, at 52, but I got this team in India and I'm really trying to learn. It's the first time I've ever been on Facebook even is with this initiative. But I think that's going to be the new medium, right? And if you look at my like videos and stuff, I've hired like a young Gujarati girl. She's like I'm kind of making her into like a newscaster, like a reporter type. So I want to create some kind of energy behind this rather than just some doctor who's kind of like preaching to everybody, right?
Right. So you got to get the information. You got second thing, you got to spread the word, right,
yeah,
about health.
yeah, right, right.
What else should our AAHOA members, if we talk about AAHOA Health, and what else should we be thinking about considering?
Well, I think this is just the tip of the iceberg, right? I mean, we are starting to deal with mental health issues, like just because you're wealthy, that doesn't mean that you don't have anxiety issue. I see a lot of patients now with anxiety, depression like symptoms. A lot of folks have a lot of stress because they're children. And these are things that nobody wants to talk about. Women's health issues is huge. Like, about 25-30% of Indian women have like abnormal menstrual cycles, so they're living with chronic anemia. And these are things that who's talking about this kind of stuff, right? But that affects this is your energy level, your weight gain, depression, social withdrawal. I mean, one of the problems that we have in this community with the Gujaratis that are in the hotel, it's almost like a mutually exclusive community, right? Like so many Indians in general, there's a mix of business and healthcare. But 20-30,000 members of AAHOA, very few in their friends and family are actually physicians, and that's one of the, I was in LA and I kind of I realized that about this, it's a very unique community that, and I think a lot of it's because most of us are from South Gujarat and a lot of the Gujarati doctors are from North Gujarat. So that's another dynamic force that's kind of happening, and one of my goals is to start to recruit younger generation healthcare providers. They don't have to be doctors, nurses, PAs, anybody in healthcare, and people that can maybe speak Gujarati. I think that's a very, very key component, is to be able to communicate in a language that they can understand. And sometimes, you have to kind of hit it hard. I have to say a couple of cuss words and say, okay, hey, you got to do this, and say, this is what's going to happen. And then you say
Right.
that in front of a couple of other guys, and the other guys will pile onto this guy. Right? This is how the conversation happens. That can happen in a brief minute while you're at the volleyball tournament or just hanging out. And then,
What about
yeah,
addressing this? Self control. Like, it's not me because I want to eat healthy or unhealthy, or I want to make these options. Sometimes it's just a matter of your genetics and, like you said, the metabolic. And so, how do you talk to a patient and say, look, don't worry, it's not you, but let's fix
so I say that to every single patient, because one of the things is we don't give ourselves a break, right? Like everybody, kind of sees themselves in our community, especially as people who like to live large. And it's one of my first biggest, I just recently heard this rap song, Chicken Poker Party, right? And this is like, it personifies every stigma about our community.
right.
But the thing is, there's so many, that's no different than what the Irish live like,
Sure.
or some of the like African American culture. So it's not that, yeah, some of us are, alcoholism is a problem in our community. But this is the bigger problem, right? Alcoholism, you hear isolated cases of liver failure, somebody needing a transplant, but that person's on a very, very, like, I mean, they're like, oh yeah, he's been drinking for 40 years, right?
Right.
Liver failure just doesn't happen all of a sudden. And so, to me, I'm like, okay, you know what? I'll take alcoholism, but this is a higher priority. We don't see it, we don't think about it, because we don't see this food in the way our eating habit as like the poison that it really is for our body, right?
And this syndrome, it's so heart disease is reversible. That's something new that I haven't heard from anyone.
It is,
And
yeah.
so,
Yeah,
right.
it is. If you catch it early before the plaques get calcified, and then even then, my 84-year-old kaka, like last year, my nephew's wedding, he's had multiple bypasses, stents and stuff. But we have such advanced treatment options now. We took him to Emory, and some very few skilled people in the country that can reopen even a completely calcified artery. Now it's a matter of network. And so the way I look at this is like, we're probably the most affluent ethnic community in the world, maybe, And so we have access. We could get access. And for us, economically, access shouldn't be the rate limiting step. I was able to do this for my kaka. So why not, the next generation of like the progression of our community really should be like, hey, all Gujaratis around the world should have access to this kind of care. Like, why not? I feel like everybody worked hard, generations have worked hard to get to where we're at. And like I was telling you before, I see this is the only existential threat to our community. We're always going to be successful, education, business, but if we don't pay attention to this is the existential threat to our community, and this is also a big issue in India, so.
Yeah. Yeah, it's not strictly a matter of whether you eat vegetarian or eat meat. It's heart disease is heart disease, right? And so diabetes is diabetes, and the metabolism has a lot to do with it. Um, so any sort of like final thoughts? My thought process is, let's put together, an action list of stuff, and maybe we'll put it on this recording and be able to talk to members and say, this is what you should be doing next. you know and there are people like me, like you, health advocates. You don't have to be a doctor to realize that you should get yourself fully checked out.
Right, yeah, no, so I mean, I have some ideas, like, you know I I would say that, I'm working with a company to develop a home test kit for all this advanced lab. So that's something that, I would love to be able to partner up with, a group like AAHOA or something to kind of get this out to like the masses of the members. I think that would be a huge service, because you don't have to go anywhere. You don't have to go ask your doctor for a lab work. I found a company that can pretty much do all this, and it's a finger stick, like how you get testosterone evaluations at home. That may move the needle a little. And then, whatever forums that we can get out in front of, network. So like I told you before, I've pretty much spent most of my time now working on this. And so I'm available. I'm happy to like do more webcasts, podcasts, whatever you think, would be helpful. I'm kind of happy to do this. We could do this whole thing in Gujarati if you want, because I think some people respond better in Gujarati, so.
Yeah, you're right. So what I'll do is after we stop recording this, let me get some stuff to edit and put in the below, and then maybe I'll share it with you, and we'll try to get it out to our entire membership, and then we
Sure.
can do follow up things too.
Yeah.
And then maybe it's a health day, at AAHOA Con or some of these other places,
Sure.
because
Yeah.
I've seen it at other conventions too. Is somebody just simply just double checks their. In fact, I was in Tallahassee, and I think it was DOs and the PAs were having a day where a health day, and so anybody who's a member of the state Congress, so a member of that representatives or Senate, state Senate, they could get their check. But also anybody visiting the Capitol that day could get their blood sugar checked and their blood pressure checked, and
Yeah.
then they may be encouraged to do other things. But yeah, so
Yeah.
maybe it's one of those things.
Yeah. I mean, even, the value of flipping out your labs, like the way you did at dinner, a couple of weeks ago. And, I noticed that even there, I'm like, hey, right away, I'm like, there's some red flags here still, so even if we did something where, we had a booth or something and people can bring labs, and I'll be happy to sit there and look at their labs and say, this, just at least give them some advice,
Sure, sure.
because a lot of people have their labs on their phones now,
Yep. It was Quest
and so,
Labs, and
yeah,
what's funny is somebody else, as technology proficient or as smart as I think I am, there's always somebody else out there who can tell you, hey, did you look at this? Did you know that the app was available? And now,
yeah,
anytime I want the lab test, I can load them up. And what's advantageous is my health insurance company knows about it too. So
yeah,
everything's sort of paid and preset, and so I can go back. And to your point earlier, I check my COVID antibodies, for example, right? And the
yeah,
reason I'm checking antibodies is, do I need to get that third or fourth shot?
right,
And because of my heart condition. And so maybe one of those final takeaways is, I think this was brought up at the regional too, is what kind of impact has COVID had? So is taking that COVID shot, has it had an impact on the heart? And I know, there's differing things that people have said, but everybody, how do I say this? Not everything you hear on the internet or from your kaka or kaki is true, right?
yeah,
So
right, right.
if you want to address that for a moment, and then
Yeah,
we'll.
no, sure. So definitely if you're at high risk, I think young people in their 20s and 30s that are super healthy, you could probably skip this COVID, because you're going to survive, like nothing's going to happen. But if you're like suffering from obesity, if, over the age of 60 and you got metabolic syndrome, which, for Indians, you have to assume that most of us after 40, it's not diagnosed. So I make the recommendation that you should go ahead and get it, right? Even if you are quote unquote healthy at 40, but the fact that, like you may have this metabolic. So what happens with COVID once you get it, it's an inflammatory disease. So it causes inflammation of your lungs, and that's, taken out some of our folks. But by and large, people are like weathering the storm with COVID. But my recommendations, if you have some kind of health issues, you're an aging population, you got other comorbidities, then I think it's still safe to take the COVID vaccine. If you're 20s and 30s and you're perfectly healthy, I don't think you necessarily need it. So.
All right, so we're coming up on 45 minutes almost. So let's do this. Let's circle back. Maybe we can have this edited in a shorter format, and
Sure.
I'll make sure that you get the balance and Bob. So what's your website right now? Where can people get more information?
Yeah, so it's onetuka4.com. So one, ONE2 KA4health.com. So there's three phases to it. So kind of made it into a narrative based on that Ram Lakhan song, from the 80s, because that's our generation, 1, 2, 4. Because there's three phases: lab work, the radiology testing, and then like the counseling part at the end of it.
Right.
Just to kind of keep it to where people are thinking about this in a manner that they'll kind of remember. So
Right.
yeah,
Well, look, I'm glad I came with this Cincinnati. I'm glad we got a chance to meet, and let's continue. Let's keep good going. So I really do
sure, sounds
appreciate
good.